Hello everyone, welcome to another episode of Occupational Therapy for Life. Last episode we wrapped up Occupational Therapy Framework, Domain and Process. Like I said before, there's two parts of the framework. The parts are Domain and Process. So we wrapped up Domain, which had 5 parts to it. Oh, before I begin, disclaimer. I'm not your therapist, and if you have medical emergencies, you should consult. You should call 911, and any medical issues that you may have, you should always get your primary doctor involved because they know your history, they have more information and more to work with. Oh yeah, and also like and subscribe. When you like, it makes it more available from an algorithm point of view. It's being recommended to more other people to get awareness to the channel. And when you subscribe, well, it says that I have a following of some sort. Anyway, so in the Occupational Therapy Framework, 4th edition, like I said before, there's 2 parts, Domain and Process. So we covered Domain already. So now we're going to cover the evaluation. So the evaluation, well, in the process, let me go back. In the process is 3 parts. There's evaluation, and there's intervention and outcome. So evaluation is basically is where we gather a lot of information, and that's the main point of the evaluation. We gather in information so we can sift through that information and try to see what is going on and how do we go about using that information that we gather. So we gather information about the client's history. Pretty much usually it's the medical history. So when I do evaluation in a nursing home, I've spoken in other videos. The first 30 minutes is dedicated to reading the chart information, find out what happened to this person from a medical point of view. Then when we go up there, when we evaluate the person, I say up there, I'm usually going up to go evaluate the patients that comes in. I go see the patient and I ask them, I introduce myself, and I'm pretty much asking them questions about like what happened and like give me your take on things, you know. What are your concerns? What are your priorities? What issues are you having? And then based on that information I gather, then the next step is what we call observation. So when I enter the room, entering the room, although I'm asking information, I'm also looking at the room. I'm looking at the way the person lays in bed, or if they're sitting up. I'm looking at the way they talk. I'm looking at they make eye contact. I'm looking at the way their body is, whether it's hunched over, if they have a kyphotic back, if they're unable to hold themselves up, if they're having problem breathing, if they look sleepy, lethargic. I'm collecting a lot of information while I'm attempting to engage with this person. And then we have, once that's the observation part, then we have what we call standard assessment. So there's certain assessments that we do. There's a bunch of assessments. One of the assessment is the Canadian Occupational Performance. Another assessment is Allen Cognitive Levels. Another assessment is the is I forgot the name of it. It's like the mini. I forgot the name of it. Anyway, so it's a quick assessment that we do with the patients, and it helps us to gather little information about how they're thinking, if they're confused, if they know where they are, what time it is. I might say, hey, remember these 3 words, tree, apple, car. And then towards the end of the evaluation, I say, hey, you remember those 3 words? I'm testing their memory out. So we get a lot of information, and we continue to get information as we continue to work with that patient. The evaluation gives us like a little bit of intro, a little bulk information we get, but we get more information along the therapy process. We look at how the way they function, how they transfer, if they have limb and pain. And one thing that I had difficulty when I was in school is when we had to evaluate a patient, I wanted to help them while I'm evaluating them, but they wanted us to understand that this person is in pain, and if they have nobody to help them, they can't do this, they can't do that, or if they do this, they're at risk to fall. or they're having a hard time getting dressed because they're in pain, they most likely will just stay that way because they're avoiding pain. So you're taking the patient where they are. Yeah, the next day they might have pain. Man's like, oh, this is the person you said requires so much assistance, but look at them now. You got less assistance. Because that's the evaluation process. We take the person as they are right then and there, and from there we chart their performance. We're not intervening. We're not trying to intervene or give you any advice. We came to see you. Can you get up? Can you get dressed? Can you get out of bed? Do you know how to operate this? Do you know where you are? Can you, how can you navigate yourself if there was nobody here to help you? That's the angle that we're pretty much coming from. And then we look at that sensory information. So especially somebody who had stroke, I'll do like a hot cold test. I get some ice, and I won't let them know. I'm like, all right, I might have maybe blindfold them or tell them to look away. Can you feel what's happening now? And I'm rubbing ice on their ankle, and they gotta let me know if they feel ice cold or at least how they respond. Same thing with heat. I might get some warm water and dip it in a towel and move it along. So you're testing their sensitivity to things. Because if the person can't feel certain things, or if they're numb to touch, we also have to consider how that may impact their awareness and safety when it comes to walking. We also want to know about how they were before this, this injury, and were they a person that had a social lifestyle, or were they a person that was retired that stayed home? All that stuff matter. We all consider all these things as we go about the performance. The evaluation. So that's pretty much it. The next section I'm going to cover is intervention. And after that is going to be outcome. And then we'll be done with occupational therapy framework. Even though these are just a quick summary, but for the most part, that's the gist of it all. And just like I mentioned before, occupational therapy framework has domains like the areas we're looking at. And process is the intervention aspect. Outcome, what do we want? How are we going to get this done? So that's pretty much it for that. Oh, and as far as the schools, usually the kids, it's a different way of evaluating the kids. Usually the kids start much earlier. The changes are noticed early, usually by parents. If it's that obvious, sometimes it's noticed by the providers when they go get their their checkup at the pediatrician. So usually there's a group of people involved, social workers, teachers, special education teachers, therapists, psychologists. There's a bunch of people involved, the main doctor, and the doctor kind of in charge of how things go. But usually a lot of cases, a lot of people might notice something, and parents usually would say, hey, I think my kid might need to be evaluated. Can you test this, that? They'll test their hearing, they'll test their eyesight, they'll test their reflexes, the motor components. So at the high school level, these kids already had been evaluation. They've usually been in the system. So we're taking them to the next level where we're like, okay, we're going to try to focus on life, because you're in high school now, you're an adult. So that's pretty much the difference between evaluating somebody who is in a nursing home and I go to see them, versus a child whose situation usually was picked up much earlier on in their life. And as far as the mental health population, usually you pick up these things as an adult starts having issues with their memories, their focusing, their ability to cope with stress and stuff like that. And they might get tested, and based on those tests, and they'll recommend a certain course of action, primarily of course from the medical perspective, the doctors. And then the doctors, they may recommend them to see a specialist like occupational therapist or art therapist or counselor or social worker. So there's a process to this thing, but either way, occupational therapy, don't be surprised, they might be in the mix. All right, everybody, that's it for now. Have a good day. Don't forget, like and subscribe. All right, thank you for your support. Have a good day. Bye.